Representative and chair of an alliance of over 40 national organisations who have got together with a determination to change this situation and to make these lives and future generations happier and healthier.
More than 1 in 10 women will develop a perinatal mental health condition during pregnancy or within that first year after having a baby. 7 out of 10 women will hide or underplay their symptoms.
What always comes to my mind is the impact that champion stories and voices have, whether that be at events, whether that be through literature or meeting other champions. And that for me is always something that has given roots and left a lasting impact for me, is those really real, tangible stories that share hope and also share that important, vital information of where we want to go next collectively.
One of the most memorable moments for me was presenting to the Royal College of Psychiatrists and talking about perinatal mental health, specifically around LGBT+ pathways and how service users can be supported.
Over the last decade, charities and organisations working in this space have come together to transform attitudes, raise awareness and ensure that services are available to parents and babies at this important time in their lives. Much of this vital work has been led by the Maternal Mental Health Alliance, a fantastic organisation of which I'm extremely proud to become patron of today.
My first memory of being sisters was being a little bit naughty, a little bit funny. She was my closest friend. Nobody should be in our situation. No one should live a life that could have been avoided. And we've got to do more, we've got to raise money, we've got to avoid more children growing out without parents. I feel like I've become more determined and more sure that she has lost her life, but something needs to change because of it. And I think she gave me that strength.
If I were to improve one thing, and I couldn't just pick one, but if I were to narrow it down to one, I would say access. And that for me would mean access to the services, interventions, support that individuals felt they needed, and that would make them accessible too. So barriers like cost or provision would not be there, but actually people would be able to access what they felt they needed without those barriers.
Without the support of the same midwife that I had during pregnancy and birth, I don't believe that I would have got through such a difficult time. It took me a long time to open up to professionals, so to have the same midwife and to have the same support from the perinatal mental health team, it was really important that I see the same person.
One positive change that I'd really like to see is more open and honest conversations about how we can all support each other through our different experiences of perinatal mental health, and how everyone's experiences are valid, different, and all should be celebrated and supported.
There is good news, just to finish as Andy had, there is good news because we know how to treat these women, and that's really great, but actually we need to look at using that money a lot better. Let's look after our mums, and I'm here.